Hello, my name is Isaac Westphal, and today I will be discussing sexually transmitted diseases and infections in adolescents. Throughout high school, it can be a challenging time for any teen. There are new developmental changes happening within the body and the mind, as well as social changes that are happening that increase stress in their daily lives. In addition, there are new interests in romantic relationships and exposure to new sexual activity. While these changes are all a normal part of growing up, it is important they can also lead to risks that can affect the future of their life, like sexually transmitted diseases and infections. That is why it is important to address the knowledge of sexually transmitted diseases. In this presentation, I will talk about the general information of STDs and STIs, how they are spread, the risks that they pose, how they are treated, the symptoms that are expressed, and how to prevent them. So, what are STDs and STIs? As the name implies, sexually transmitted diseases and infections are diseases and infections that are spread through unprotected oral, anal, and vaginal sex. While these are the main pathways in which these diseases and infections are spread, they can also be spread through skin to skin genital contact. These diseases and infections are such an important issue because teens and young adults have the highest rates out of any age demographic. The CDC states that over half of all new STD and STI cases are seen in teens and young adults. There are also different types of STDs and STIs, specifically bacterial and viral. Some examples of bacterial would be chlamydia, gonorrhea, and syphilis, and some viral examples would be the human papillomavirus, or HPV, herpes, HIV and AIDS, or hepatitis B and C. It is important to note that both of these types affect males and females the same. However, chlamydia is the most reported STD, and HPV is said to be the most transmissed or spread STI, and it just goes unreported. So, what are the risks that they pose? If identified, they can be easily treated with antibiotics and antivirals. However, if they are not identified, they can pose serious health complications such as pelvic pain, pelvic inflammatory disease, pregnancy complications, cervical and rectal cancers, and infertility. These complications affect males and females. However, pelvic inflammatory disease, pregnancy, and cervical cancers affect only women due to their anatomy, while pelvic pain and rectal cancers and infertility are the only complications that can happen to males. So now that we know some of the risks, how do we identify the STDs or STI? The easiest way is to get a screening from a medical professional at a medical clinic or an organization that provides the services. Some of the symptoms that might prompt you to get a screening would be painful or burning urination, discharge from the penis or the vagina, unusual vaginal bleeding, pain during sex, fever, sore or swollen lymph nodes, or rash on the torso, hands, or feet. It is important to note that not all STDs and STI symptoms manifest in the same way. So the only way to know that you have an STD or STI is to get a screening after unprotected sexual activity. Now that we know how to identify an STD or STI, we also must identify how to prevent the spreading of STDs and STIs. So the most basic way that you can prevent it is to abstain from any sexual activity. Without participating in any activity, it is impossible to spread it. Another method would be the protection method, or use of condoms and dental dams. Female and male condoms are available for both anal and vaginal sex, and dental dams are available for oral sex. Another way to prevent the spreading would be not to have multiple partners, as having more than one partner would increase the rate of spreading. And the final way that I identify is to avoid drugs and alcohol. It is noted that consumption of drugs and alcohol increase the rate of sexual activity. So avoiding them altogether would decrease the spreading of STDs and STIs. So thank you for watching this presentation today. I hope that you take the issues that I addressed and apply them to your life with new sexual activities now or in the near future. Thank you.